I think by now, most of us would agree that BMI is a very imperfect indicator of someone's overall health and wellness. So why do we still use it as a cutoff for elective surgery? Let's discuss the evidence and why we do that to keep patients safe. Your BMI is a calculated number that is a ratio of your height and weight. So for a certain height and a given weight, it gives you a number. That's your BMI. Let's take someone though that's 5'7". If they weigh 200 pounds but have very little muscle, it's mainly fat, they're going to have the same BMI as someone who is 5'7", also weighing 200 pounds, but is pure muscle. Now, if you look at those people on paper, they're going to have the same BMI, but you can tell probably just by looking at them that their health and wellness is very, very different. So why would we potentially say no to both of those patients for surgery? It's because studies have shown that BMI does correlate with postoperative outcomes for the average patient. These studies are large population studies where they look at lots of different patients and patient factors and characteristics and try to get rid of all of the other confounders that could impact outcomes so they can just focus on BMI. And when we think about breast reconstruction, there are studies showing that when your BMI gets up into that 35-40 range, the average patient's complications does significantly increase. Now, every plastic surgeon has different cutoffs. Some's BMI is 35, some is 40, some don't have a cutoff. And that is based on them reading the literature, applying it to their patients, and looking at their anecdotal experience to view what they think is the appropriate patient cutoff, if any. Now, I discuss this with patients. We talk about what they're doing for weight loss if they're trying to lose weight. If they've tried and it's failed, what other options are there? For some patients, they've tried everything and they still can't bring down their BMI. So then we need to have a conversation about, is it worth doing this surgery or should we hold off just to be safe? Now, sometimes patients get very upset with this, and it is an uncomfortable conversation to have with someone asking them to lose weight, especially if they don't want to, because they say, I heal well, I don't have complications after surgery. Why are you saying no? And it's hard, once again, when we base these recommendations on population studies for the average patient. But it is, once again, just aiming to keep you safe, especially for elective surgeries that can be postponed. If you've had surgery, did your surgeon talk to you about a BMI cutoff? If so, what was it? And did you feel like the concept was well explained? Let me know below.